Hi, everybody. Welcome. I am Beth Contos, President of the American Federation of Teachers, Massachusetts. Thank you for participating in this forum tonight. We all know there's lots of information and misinformation out there surrounding the pandemic and the current health crisis we are in. As good educators, we know that information is crucial to making smart and healthy decisions for our communities, but more specifically for our school staff, librarians, and our students. Tonight, we bring you experts in the field of public health and education to give you clarity and facts. That's why we created this forum that will be one in a series as a public service to help all of us get to the truth about the coronavirus, how it spreads, and the impact it has had on the schools and our families, as we have had more than 4,000 positive cases in our schools since the beginning of October. We are excited to have a range of public health experts and educators to discuss this critical issue. And now I will turn it over to our moderators, Mary Najimy, the president of the Massachusetts Teachers Association, and Carlene Pavlos, the executive director of Massachusetts Public Health. Friends, there you are.
Hey, Beth, thank you. So good to be in partnership with you, as well as these committed group of educators and public health specialists who are really working for the common good. Mm-hmm. Hi, Charlene. Charlene, you're on mute.
Hi, Mary. It's really great to see you. And Beth, it's so nice to, there you go. But Beth, it was so nice to see you. And it's great to be with both the AFT and the MTA tonight.
Yeah. So as Beth was saying, we've been living in the pandemic for 10 months now. In the midst of the rising COVID-19 cases in Massachusetts, people are beginning to worry, how safe are our schools? Right. Our governor is saying, and has been saying from the beginning, that the benefits of being in school outweigh the risks. And while that is absolutely true for a great number of students and families, it is untrue for an equal number of students and families. So tonight, we really want to look at what's the disparate impact of the pandemic on high needs students and communities. What are the resources schools need to make in-person education as safe as possible? So we've convened a group that includes public health professionals, educators who represent both pre-K-12 and public higher ed, community leaders to help us answer these questions.
And before we begin tonight, I just want to acknowledge that this is a topic that people bring a lot of passion and energy and even anger to this topic. And I think that that's in large part because we are trying to balance two widely shared deep values, right? One being safety and health, our fundamental health, and the other being our children's education. And these two values are being pitted against each other in a lot of the public conversation. So we're really hoping that tonight we can bring more conversation and less black and white thinking about this topic. And we're really hoping that this can be an open conversation about the issues that we're facing right now. And folks who are out there, we're hoping that you can share your comments and questions and really take advantage of this opportunity to learn from some experts and get insight, perspective, and expertise from the incredibly distinguished panels of individuals, both public health professionals, educators, community leaders, and people who are on the front lines for tonight.
Right, and to do so, we've framed the discussion in two parts. The first part, we're going to bring in educators and a community leader from Chelsea and talk about the lay of the land. There's a story of two Massachusetts, and we're going to explore that. And then we'll bring on a panel of public health experts, epidemiologists, pediatricians. We're also lucky to have members of our Environmental Health and Safety Committee be answering your questions live in the chat, because there's no way this panel could get to every single question, but we know there's a lot on your minds and you feel the need to have answers. So without any further ado, we're going to start with Kyle Jacoby, who's the president of the Wellesley Teachers Association, Gladys Vega, the executive director of the Chelsea Collaborative, and just announced as one of 2020's Bostonians of the Year. Congratulations, Gladys. And Dean Robinson, who's an assistant professor of political science at UMass Amherst, and he's also a member of the MTA Environmental Health and Safety Committee. Scott Fulmer, who's the chair of our Environmental Health and Safety Committee, will be answering questions. So when you see questions coming from Scott Fulmer, Tom Estabrook, Rafael Mora Arasso, and Mike Cerisi, those are our environmental health and safety specialists. They're not just random people watching, answering your questions with possibly right information and possibly wrong. Their information will be highly accurate and thoughtful. So welcome, Gladys. I want to start with you.
Hold on, what the hell? Yes, I'm sorry, I'm having technical issues. I have no idea. I hear like a lot of background noise.
And you're sideways on our screen. Can you hear me though?
Hold on just 1 minute.
Yeah.
Okay. So I've been trying to tell me how to flip it because I don't know how to flip it.
Gladys, are you on your phone?
You're also sounding real, like with a lot of noise behind. I don't know if it's your audio. I can't hear you. Can
you hear me now?
Yes.
Okay, so I'll speak closer to the microphone. Gladys, we wanted to start with you. Before the pandemic, the Chelsea Collaborative joined the Council for Fair School Finance lawsuit that sued the state because of a lack of adequate funding to the Chelsea public schools and public schools in general in Massachusetts. Can you talk about what were the conditions in Chelsea public schools that made you feel joining the lawsuit was the right thing to do?
So I think for us, it was an easy step to be part of this lawsuit. We saw the unfairness about misrepresentation in terms of the way that the formula was working towards the parents. I actually think that we continue to have very limited resources, especially for children of color and for newcomers. For us, the fact that we felt that in the school system our children were being marginalized, and it was probably not intended, but the regulations were so old and never really changed drastically that I felt that for us we needed to be part of the lawsuit. We needed to make sure that children that were coming in this country as newcomers were not being marginalized just because they were the new kids on the block. And for us, it was incredible to be part of a lawsuit, be able to win because we had lots of wins in the process. But it doesn't, but I think that although you win when you do some lawsuit or you threaten an administration, it doesn't mean that the job is there, because the implementation of a lawsuit or the implementation of the law is in the hands of people however they feel, in the hands of powerful people that feel that they have the right to interpret it their own way. So for us, I think that was key.
So how has the pandemic changed the circumstances in Chelsea?
I would say the pandemic has affected Chelsea horrifically. I would say that I cannot imagine how parents are teaching at home, because some of them have to be with their kids in a classroom setting, and then they have to get called to work in a restaurant for 20 hours. They have no babysitting, and that is why we have so many issues of economic sustainability. The fact that parents don't even know how to sort of like get very follow the Zoom instructions at times, and they're not able to help their children with the academia in this virtual world is extremely hard. So I think that, and although we have an incredible superintendent and incredible school committee, I think that we haven't done enough because there's not enough resources ever. And I truly feel that I would love to have a way where children begin to transition in. Um, and so I think that for us, that's been very hard. Also, the fact that young children, like for example, we run the summer youth employment program, and we did the summer youth employment program because we wanted those parents to benefit from the income that we were giving the youth. How sad is that, right? To think that a 14-year-old has the responsibility to work during the summer in order to provide towards the rent, towards the, avoiding the eviction, avoiding that they get the lights disconnected. And while they were not um, able to disconnect lighting because of the pandemic and the monetarium that we had, when you have community residents living in a 3-bedroom apartment with 3 families, the person that rents that apartment has the right to do whatever with you, because after all, you're the one that is not paying that individual. The landlord at times is not even involved. So our housing setting is very different than a regular household setting. We have 3 different families renting a 3-bedroom apartment. None of them know each other. And you have at times, right now, I have 17 people in a 4-bedroom apartment. One of the 4-bedroom is a closet that was used as a food pantry, not a food pantry, but a closet to put the food. And now it has a crib mattress and 2 children are sleeping there. So that's the reality of our community. And unless you're on a daily basis checking on these families, or unless the family is able to feel trusted enough to tell the story, it's very hard for the parents to be engaged in the school system, especially when they're living in conditions real bad, because their fear is that DSS will be called, that then DSS comes with immigration, because anything that is nonprofit is related to the government, and government is Trump, and Trump hate immigrants. So we've been dealing with lots of issues where we have to basically move one of those families to another overcrowded house that is less crowded but continues to be a room rather than an apartment. And for us, for the children, that's a horrific situation to live in, and there's a lot to worry for them. I know that I tell you that although our school system and our city councilors have done everything in their power to put food at the table, to contribute um, to through EBT cards and stuff for food, having children in your home full time. I tell you, as my mom was a single mother who had issues of substance abuse, I knew that if I didn't get to go, me, Gladys Vega, and my 3 sisters and my brother, rest in peace, that if we didn't get to school at 7:30, I would go without, into lunch without eating. And then when I get home at 3:30, my mom would have only rice and beans at 3:30. And from there, I had no snack, no access to any food, because that was what it was. I didn't have cereal. It wasn't like, I went through hunger issues in my childhood, and somehow food follows me. So I think that those are the things that our children are facing. I
Yeah,
really think that children are facing also hunger issues while they're at home.
right. And Gladys, our schools have become centers that have had to take on the responsibility of solving the problems of society. You talked about so much there. You talked about, the living conditions. We know that the more people that are in a household, multi-generational, multi-family households, that becomes a breeding ground for the pandemic. We also know, the CDC today came out with their morbidity and mortality weekly report, and they once again affirmed that it's families of racial and ethnic backgrounds that are not white have more fear and concerns about the health and safety of sending their kids back to schools. What do you sensing or hearing from the parents that you work with? Because the dilemma that you noted, the dilemma, they are often essential workers and they have to go to work, and yet now they have to figure out solutions for childcare and how to support pandemic learning. So tell us a little bit about what are their worries about school, and then just end by telling us what are some real resources that families who live in Chelsea and similarly demographic towns actually need.
So I wish that I had some words of wisdom in terms of how hopeful I am. I actually think that this second wave of the pandemic, it's hard and harder because I feel at times, I tell my staff, and I was talking about it this week, that I feel at times we also contributing to the pandemic, because when I have a family that shows up with bags because they got kicked out because one family member has the coronavirus and they rent in that room, and then there's only one bathroom, one kitchen available, the family that rented their room for $1,000 tells them you have to leave because you have the virus, because we have two other families here. Then I place them immediately in a hotel, and after I place them in a hotel, they're not able to stay in a hotel for 3 to 4 days. So in those 4 days, I have 4 members of the staff figuring out where they're going to be living, making housing arrangements. And what happens is that I sincerely then find another family with more people living together. And I feel that what we're doing is continue to contribute because we're not isolating people. We don't have the luxury to have one individual with the coronavirus in one room upstairs in the 3rd floor and everyone else in the 2nd floor or 1st floor. That doesn't happen. So I think that although we have created safe space, and when we find out, like for example, last week I found out that a whole building had 12 people with coronavirus, 200 apartments, and 12 people had the coronavirus, and one had died. I immediately went with all these sanitizers, and I went with masks, and I went with gloves. I did everything, and I took. We have a truck that I think I own because I have had it since March 20th from the rental company. So I told the staff, pack up the truck that we're going out to the neighborhood. But then people are also getting the coronavirus fatigue. Parents are getting that fatigue. It's very hard to tell a young person, keep your mask on. Like, it's very hard. So I really think that we're doing everything in our power, but I'm very quietly afraid for this second wave because people are beginning to give up. So I'm constantly in the news telling people, don't give up. In terms of resources, we're trying to offer, the raft system. We have today we were giving out checks to assist families, cash assistance checks from donors that said use it for COVID-19. So we have done close to $500,000 of those to give to the community. But giving a family of 4 a check of $250 when they have 3 children in the school system, it's basically nothing. That goes for 1 day, and it probably lasts of groceries 3 days, and that's it. So I'm sorry that I don't feel optimistic.
Yeah, no, Gladys, it's nothing to apologize about, and I think this also speaks to what's so critical about the social movement that communities and labor are uniting around to deal with all of the issues that you just addressed, and the housing eviction, make sure that there's income security, food security, making sure our schools can be safe to return to as one way to support families who have to work. I want to actually turn to Kyle so that we can hear Kyle's story exactly about what a privileged community, this is the other side of Massachusetts, what a privileged community can afford to do on private funds to make sure they have enough, as much in-person learning as reasonably doable. Kyle, tell us what's happening in Wellesley in the public schools.
Thank you, Mary. I think You nailed it. Wellesley has a lot of resources, and we have been so incredibly fortunate not to have the types of interactions, or not to have as many of those types of interactions that Gladys has had with the members of her community. I would say that Wellesley has really kept schooling as the focus of their challenges in the COVID-19 crisis. The Wellesley Public Schools have been incredibly community focused, learning focused, highly focused on student engagement, trying to kind of really continue its identity as a school without necessarily having all of the necessarily difficult attachments, I think, that Gladys spoke to. I would say prior to the, of course, we had those prior to the pandemic as well. But even as the pandemic hit, we kind of look back at our schedules and our academic lives, and we look at what has changed for us. And there certainly are a lot of significant changes and adaptations, but with each change and adaptation does come some element or elements of support. And that sort of, whether it be academic support or monetary support, time support, we've been able to kind of solicit that from the private donors of our community.
So Kyle, talk a little bit more too about the pool testing, because that was private support from the community, which I would assert is the responsibility of the state, even though Wellesley residents have the economic means, because that was one way you have a way to reasonably assess the risk so that you can know how to respond.
That's exactly right. Yeah. So early in July, actually, members of the community and also members from our own union, a member of the Wellesley High School staff and her husband had been working on a project to try and get testing for the Wellesley Public Schools and the members of that community. And to date, we now have PCR testing once per week for every secondary school student and for every staff member in the Wellesley Public Schools. This was all done by private donors, to which, again, while we are extremely grateful that we have this resource, I cannot agree with you more, Mary, that really is a responsibility that should be state-driven, or it's very much a state-driven initiative. I know that our people have been trying to work to get the costs down and network with other businesses and other donors, but I feel like the people of Massachusetts and the state of Massachusetts have a duty to educators across the state and a duty to students and families across the state to provide a level of assurance that when they go to school, they are going to be as reasonably safe as they can be.
So you called it PCR testing. What is that? Can you explain how it works and just what it has helped, like how it helps the schools?
Absolutely, yeah. It's a pooled testing. So we not to get too gross or too detailed, but it is a spit-based test, a saliva-based test. Every Monday morning, I get up, and before I do anything else, before I brush my teeth, I spit into a tube, seal it, and I bring it to our front office. And generally by Tuesday, we know the results. And we kind of rinse and repeat every week. Pool testing essentially is my tube gets mixed with other people's tubes. We get tested as a pool, and then if that pool comes back positive, then they test the individual samples. So what it does is it allows us to reduce the costs overall, where we're paying for one test process, and 6 test materials, but we're not paying for both 6 test processes and materials, or whatever number that is in the specific pool itself. And the test, while it's not it's not the world's most perfect diagnostic. They do run it a couple of times. If they get some fuzzy results, there's enough spit to go around. They make sure that they follow up with us, and we've actually been able to catch asymptomatic cases of both students and staff across the district, and knowing that we had this kind of like early activation, or almost like an early warning system. We're able to say, all right, you're a potential you're a potential positive case, you're going to remain home for 2 weeks or until you test negative or get a confirmation of a negative test.
Kyle, could I just interrupt to ask for a minute? Have you used, have there been asymptomatic cases that have been found, and have you, in fact,
We have, yes.
had to take
Thank you for
action?
asking. It's very true. We have had 2 instances where we have had to close either a classroom or at one point the entire high school. So right around, actually it was on Veterans Day, the superintendent called me and I kind of smiled and was like, uh-oh, not good to call me on a holiday. And we were able to, we ended up noticing that there was some in-school spread in both our amongst our administrator work and then also a couple of other students, and we decided to go ahead and shut the school down for 2 weeks. And so we closed to and through the Thanksgiving holiday, reopened shortly after Thanksgiving. We actually did a new baseline test over the Thanksgiving holiday break. Most of our faculty came in and most of our students came in to run the test and do a baseline, which is basically it's like a reset or a recalibration. And then we reopened the Tuesday after Thanksgiving.
And that Kyle is bringing deep anxiety to so many families and educators that the surge is on the rise. We know from public health experts that we're not going to see the effect of Thanksgiving for 2 weeks beyond. People are frightened to death because there's not a reasonable way to set a baseline of how safe of what's happening in the schools, of the risk, essentially, after holidays. I want to turn to Dean because while there's so much, higher ed is in such a crisis with funding and cuts and layoffs, that doesn't make the news. But what does make the news is the actual proactive thing that's happening in higher ed in terms of regular testing that's allowing students to come back to campus. Dean, talk to us about what UMass Amherst is doing.
So UMass Amherst this fall has really engaged in very extensive and widespread testing. Over the course of the fall semester, UMass Amherst was testing 2,000 to 3,000 students each day, and again, this is an attempt to test for asymptomatic cases. Students living on campus were encouraged to get tested twice each week. Students off campus were encouraged to get tested twice each week. Faculty and staff working on campus, which were a minority of the total, were encouraged to get tested once each week. And that widespread testing, and I can tell you from my own personal experience, I probably underwent 6 tests myself over the course of the semester. The process took 10 minutes, and you get the result within 24 to 36 hours. And with this widespread and extensive testing, it really worked to provide the kind of surveillance you want to catch potential outbreaks. There was more of a problem with students living off campus than there were on campus. But what the fall semester showed with respect to this strategy was that widespread testing and proper wearing of masks and social distancing, especially on campus, proved to be very effective in mitigating the risk of COVID-19.
Right.
So that's what I'm doing.
I'm thinking about the challenges that Gladys posed. I'm watching the comments in the chat. People are rightly saying it's not right. It's not just that a wealthy community like Wellesley has the means to do this, but the rest of us, or too many of us, don't. Dean, what are the lessons that we can learn from the Wellesley story and the UMass story about how effective testing is and how doable it is, so that we can apply that to a more widespread program?
Absolutely. So, from my experience, I think I'd support what other panelists said that this is really the responsibility of the state to provide the money, the resources to engage in widespread testing. What we're doing at UMass Amherst is not being replicated across all of higher education. So Holyoke Community College, as an example, does not have the same strategy that we have available to us. It should not be a matter of internal resources of a particular school or institution or district that leads to proper safeguards in a deadly pandemic. So whether or not it's testing as we're doing, which is expensive, which is, which does cost a lot to do on an individual case, or something like pool testing, which I think could be scaled up to cover students and staff and educators statewide, we should really urge that be an essential aim provided by the government of the Commonwealth of Massachusetts. So I think that's the important lesson, that you can do face-to-face instruction more safely, but it's essential to have the right type of surveillance. Otherwise we're walking into the unknown, and we know that COVID-19 is very opportunistic as an infectious disease.
Or, we need reliable data so we actually can know this week things will be relatively safe, or this week they won't. And I want to note what Katrin McDonald is saying in the comments too. You're absolutely right. It's testing, it's the mask wearing, it's the social distancing, it's the indoor air quality. It's all, each of these things has to work together as a system. And the testing allows us to assess. Carlene, go ahead.
Right. There's no one silver bullet, right? So it's a layering of protective factors, asymptomatic testing being one of them, layered with mask wearing, layered with having enough space between students, layered with low community rates, layered with, so it's all of these layers, and that's really what will get us
right. Thank you, panelists. I'm going to have Dean stay on as our environmental health and safety expert. We're going to talk now there is still a lot of people are not clear exactly on what the science says, and we want to talk about that next. But Gladys, I really want to say that the MTA has always stood in solidarity with the Chelsea Collaborative, with all families and students of color, with working people, and with the community. Your struggle is the struggle of the parents of the students that are in our public schools. So we will continue to fight with you for racial and economic justice. Stay well.
Thank you.
Thank you, Clara. So we now have an opportunity in our next panel to learn about some of the key scientific issues. And I want to say it's often difficult to understand whether the governor's decisions are being guided by good science. So that's why we reached out to this panel of experts to help us understand what's happening in schools and communities and what the science tells us. So this is a great opportunity to learn more about COVID-19 transmission, what we know and what we don't know, its impact on different age groups, and more. So I'm really happy to be able to introduce you to our panelists. First is Julia Kohler. Julia is an MD, a pediatric infectious disease specialist, and she works at the Harvard Medical School. We also are joined by Natalia Linos, who is the executive director of the FXB Center for Health and Human Rights at Harvard. And she is also a public school parent. Dean is going to remain with us. Thank you again, Dean, for continuing to be on this panel. And finally, Jody Sugarman-Brosen, who is the Executive Director of the Mass Coalition for Occupational Safety and Health, or MassCOSH, and she is also a public school parent. So it's really wonderful to have all of you here with us. I'm wondering if we could start, Julia, by having you talk a little bit about what we do know. What is the science clear about? And talk to us a little bit about transmission.
Yeah, thank you, Carlene. My name is Julia. I am a pediatric infectious disease clinician. I care for children with serious infections. I'm also a molecular biology researcher. I am here in my personal capacity, in my individual capacity. And it is an honor to be here because I would like to speak to the point that what we want are safe schools that are open with the resources to be safe for everyone, for all children, for children in Chelsea, in Everett, in Lawrence, as well as the children in Wellesley. We want all children to be safe and healthy. I'm going to start with just a few basics because there are things we know. And regarding start with transmission. So there are a few things, despite the fact that the science is still developing, but we know that about half of all infections are transmitted by people who feel healthy, either because they are not going to get sick from their infection with the virus that causes COVID-19, or because they're in their incubation period and they will start feeling sick in 2 or 3 days after they've already infected another person. We know that the virus is transmitted in 3 ways. Number 1, by droplets that come out of our nose and mouth when we speak or sneeze or cough, and that are large enough to see them. Number 2, by aerosols that also come out of our nose and mouth, but they come out when we only breathe, and more intensely when we speak or sing or shout. And number 3, by touching surfaces on which the virus may have landed and then inoculating that virus into our eyes, nose, or mouth. We know now that this latter transmission path, this touching, is the least common or the least important, whereas the droplets and the aerosols are each estimated to cause about half of the infections. So in terms of how to protect ourselves, we know that the standard cloth or surgical masks that we all wear, they prevent droplets and they diminish the aerosols from getting into the air from me. From my nose or mouth, that mask will prevent the droplets and diminish the aerosol. So it's going to protect the person beside me. There is a certain amount of protection also that I will experience from droplets of another person, especially if I also wear glasses or a face shield. That's the only role of the face shield, to protect me from droplets. But the face shield and the mask, the standard surgical or cloth mask, is not going to protect me from the aerosol. So I do want to just touch a little bit more on aerosols because they are a little confusing to some. So they are basically clouds of tiny particles that contain the virus, and I like to talk about them like some invisible cloud of smoke that builds up around someone who's just constantly smoking a cigarette. So if I am infected, I am like that person who is building up this cloud of invisible smoke around myself that is a cloud of virus. And so if you think about that smoker, the smoker outside, that cloud is going to blow away. And so if I am closer to that person, the amount of smoke I'm going to take into my lungs is going to be small because the air currents are blowing it away. But if I'm inside, that smoke, that invisible virus cloud is now building up, to a density that if I breathe that into my lungs, it is possible or likely that I'm going to get infected. And this is why outdoors activities are so much safer than indoors, and also why ventilation is so critical, because that's what prevents that smoke cloud from building up to that infectious density.
Julia, can I ask you, that makes me think about the 15-minute rule that keeps changing. In the beginning, we heard you shouldn't spend more than after 15 minutes, consecutive 15 minutes, you're at risk for contamination. And then that changed, that it's 15 minutes over a longer period of time. What do we know for sure or confidently about the duration of being close or in a closed room together? And now there's a new 90 limit on staying in restaurants. Is 90 a magic number? I think these are the things that cloud people's understanding.
Yeah, these are very good questions. And the difficulty is that the more virus that I'm exposed to, like the denser the cloud is, the closer I am to the person breathing out that cloud, and therefore the more concentrated the virus is around them that reaches my lungs, the more likely I am to get infected. So it is just, I think that 15-minute or other rules are just very, very rough estimates about what I can expect in terms of my infection risk. They are not laws of nature, and they are not definitive in any way. There's a lot we don't know. That cloud is not a visible cloud. We can't, in daily life, measure the amount of virus that's in the air at any spot, or let's say in a classroom or in a cafeteria. So these are just very, very rough rules of thumb in terms of the exposure risk. So I would say there's no safety in completely adhering to a rule like that, because if someone is infected and is at their peak of infectivity, which is around the end of the incubation period, then I may be around them for shorter than 15 minutes if I'm not wearing a mask.
So Julia, we have a really good question from those who are on Facebook about the claim that there's no spread in schools. I want to note that just today, the Department of Elementary and Secondary Education released data that shows just in the last week, more than 500 new cases among students and more than 420 new cases among staff, which brings the totals to about almost 2,400 for students and more than 1,700 for staff. So we also know, because the state epidemiologist, Catherine Brown, who worked with the Department of Public Health, acknowledged some spread in schools. Can you talk to us a little bit about school spread, how likely it is, how it might happen, if it's pediatric spread, if it's from adults? Give us a little information about that.
Yeah, of course, I don't know the details of these schools in Massachusetts and of the spread that was detected, but in general terms, it is known that children do have the same level of virus, the same viral load in their respiratory tract when they are infected as adults. It is thought that they may be less likely to spread that, although that's not known. And there's precedent for that with other respiratory infections, simply because children are smaller. Their, let's say, force of breathing is lower. So maybe an infected child that I'm sitting beside will be less likely to infect me than an infected adult. That's just, one of the basic, principles here. It is known that many children do not get, or the number of children who get seriously ill is much less among all the infected children than among adults. However, in every age group, children have gotten seriously ill, children have died, and unfortunately, we can't predict who is at risk ahead of time, although these underlying conditions that place adults at risk also place children at risk. We know that transmission can occur from children to adults. It can also occur among children. It can also occur among adults in a school, and that is, and it can occur from the adults to the children. So, you know, it's a virus. It's kind of almost, it's not that hard to figure that out. And the protections that really protect anyone anywhere, which is the mask, the ventilation, cleaning the air in whatever way, whether you open a window, whether you have an HVAC in your air conditioning, whether you have like an air filter in the room. There's many different ways that around the world, school rooms have been made safe. That will reduce the risk. Eating because the mask is off, inevitably is a higher risk. Eating in close proximity is a very significant risk, both for children and for adults. And one very important issue is that children tend to reflect the infection rates in their communities, which is why among the 121 children died of COVID that were known to the Centers for Disease Control by the end of August. And 80% of the children who died were Black, Latino, or Native American, which reflects about twice of each of these groups' proportion of the population. And very shockingly to me, about a third of these children died before they were admitted to a hospital, either at home or in the emergency room, reflecting the lack of medical timely care. So if a community like Chelsea has a very intense transmission rate, of course the children are also going to catch the virus at home or wherever else they are. If there are 17 people living in an apartment, how do you avoid exposure to the virus? So in addition to maximizing the safety of the school room by, having a distance so that even if I'm exhaling virus, some of it gets caught in my mask and some of it just disperses away, having the ventilation, being sure that eating can be done safely, protecting the children on their way to and from school, same thing, the ventilation, the mask, that and reducing the transmission in the community, protecting people at work, protecting the workers in Chelsea. So it's a combination of factors, and as someone else has shown, there's this Swiss cheese layers of protection. Each layer has a hole. The mask will let some through. The ventilation may not be perfect at all times. The testing may not be adequate or may not be sensitive enough or whatever. Each layer will catch some of the transmission, but may let some through. But if we have enough of them in place, we can keep children safe in the schools. They can go to schools, but those resources have to be in place so that children can go to school safely and so that children are not exposed to the virus at home. And that can only happen if their parents and their community is safe.
Yeah. And you know, I want to bring in Natalia on that question of spread. So Natalia, how does community spread actually connect to spread in schools? And are there lessons from other countries that we can learn about how to keep our schools open?
Thanks so much for that question. And the answer is it very, very, very much is closely linked. And I worry that in many of the conversations we pit, schools as if they are in isolation, but schools reside in communities. There are parents, so community risk is, reducing community risk is the best strategy to allow us to have safe schools. So by definition, that means we might have to make difficult choices outside of schools as well. So many countries in Europe during the first wave, in March, closed down everything. This time around, they've made the choice to keep bars closed, to keep restaurants closed, but to open schools. And that was a trade-off that they decided. They decided that schools are important. They are important for parents, for working moms, especially because of the gender inequities that we see, and that to get schools to be safe for the teachers and for the students, for the custodial workers, we need to control the community spread, and that means everything else stays closed. Some countries have allowed for a tiered, my parents live in Greece. I grew up in Greece. Their elementary schools are open, but not middle schools or high schools. That's the compromise they're facing right now. But restaurants are closed, and every other measure is really strict. I mean, to the point where anybody flying into Greece has to quarantine for 10 days. The fines are really high. It feels in many ways that in Massachusetts, the economy, businesses, travel, everything, and then schools are kind of left as, please open up in full. But in order for schools to open up in full, we need to make sure that the community spread is reduced. And what's important to point out here is that community spread is not the same. My daughter goes to school in Brookline. It's not that high. But if she were in school in Chelsea, I would want her to have the same opportunity for in-person instruction. She's a 7-year-old who is having some reading difficulties. She hasn't gotten it down yet. I don't know how to teach her how to read. So what does that mean? It means that we need to provide the resources to the schools in Chelsea so that they can have, for example, a class size of 1 teacher with 4 kids, not 1 in 10, because we can expect that the community spreads. So we need to put resources into schools and ensure that the community, the trade-offs are in favor of parents, of kids, and of teachers.
Thank you. Julia also picked up on, there's questions in the chat about, are kids really spreaders? And do they spread to adults? I can tell you from my own experience, 3 years ago in my kindergarten classroom, we had a case of strep that went from January to May. Every child got it at least once. Some children got it twice. A very small handful got it 3 times. I got it twice. So I don't know if that's relevant to understanding spread in this case. So maybe one of you could speak to it. And then even Jody, Jody, you bring the expertise of worker safety. Julia did talk a lot about the protections inside of the building, but if you could add to that, and even in these settings where there's remote learning, but the adults are in the buildings, how do we have to keep adults safe?
Sure. I did want to take one step back and say something that Natalia had said about the decisions we made in Massachusetts. And I think back to early in May when the governor created a reopening advisory board. And that reopening advisory board was comprised of all CEOs. There were no labor, there were no workers, there were no folks representing those on the ground. And what we ended up with was a reopening plan that was focused on the economy and business and prioritizing that above all. And ironically, prioritizing it for those who run those businesses and those employers, not so much those who work within those places, because the safety net was not put in place to allow them to take work off to quarantine. The health and safety regulations that they put in place for workplaces did not address major aspects of the way that people are exposed, most importantly through aerosol and ventilation. And I think to talk about ventilation in schools is a really important piece. And there's a lot of confusion sometimes between air quality and what we talk about, and the importance of understanding the protection from COVID and exposure to COVID is more about the amount of fresh air that we are bringing into a building. And that means we're looking not at necessarily air quality, but we are looking at what's called air changes per hour. How much fresh air is coming into a room. And I say room because it can vary literally classroom by classroom. How much fresh air is coming into each room to allow that dispersal of that aerosol. I live in Boston. I'm a parent in Boston. I have a child in a high school, and I think a lot about this because in Boston, there are 130 school buildings and only 37 of them even have central HVAC. So what needs to happen, what we need to do is to be able to understand and measure and do ventilation assessments to figure out how many air changes per hour there are to ensure that those classrooms are safe. Many school buildings and many school districts are not doing that. They are testing carbon dioxide in empty school buildings. They're giving information out to parents that can be misleading. And this is really, as a parent, very frustrating as well, because I truly want to see my kids and the buildings that they're in and the teachers and staff in those schools safe. And by sharing misleading information, it just pits teachers and parents against each other, and it is not resulting in good results. So are not giving us good results in terms of health and safety. So I think that it's really important that we understand we're looking at how much fresh air is coming into the building. That's measured in air changes per hour. That's what teachers should be demanding to understand, to know if their classrooms are safe, in addition to the personal protective equipment that is critical, the masking, the distancing, the hygiene. All of that is important, but and air purifiers can play a critical role as well with HEPA filters. I want to be really clear. There's new kinds of air purifiers that are being marketed. Those we don't know the science on those as much. HEPA filters are proven. Air purifiers with HEPA filters can really help improve that air changes per hour and provide filtration to make a classroom safer.
Yeah. And Jody, you said it's pitting parents against educators. It's also pitting parents against parents. There isn't consensus. Some parents have very different risk levels and fears than other parents. And so there's tension there too. And I want to pick up on that. I don't know if it's widely known that how much work on indoor air quality, ventilation, et cetera, has been done in the buildings as a result of negotiations with the union. The superintendents and the school committees are claiming that the governor should have pulled the reins in on the teachers' unions. But what happened was there were mutual agreements made between school committees and the teachers' unions in every district with community input. And much of what we were pushing on was the environmental health and safety in the building, because too many of our buildings before the pandemic were just mold and rodent infested as well. So I want to take that idea back to Julia, because what we continue to hear is that we should just go back into the buildings because that's what's best for the emotional wellness of our students. But, Julia, you're a pediatrician. How do you think about student wellness in terms of what's the impact on their wellness when the adult caregivers get sick and or hospitalized, or if they feel the lives of the adult caregivers aren't being valued? How does that impact kids to be witness to adults getting sick who they care deeply about?
That is a very, very important question. I want to get to that in one moment. I do want to clarify that different pathogens are spread in different ways. Many viruses are actually spread at a much higher level by children to adults than by adults among each other. That's why, parents of young kids tend to get sick a lot. Grandparents, when the grandchildren were over, they were getting sick. That happens a lot. With this virus, actually, children seem to be less of those little super spreaders than with many other viruses. Fortunately, that does not, of course, diminish the importance of having these safety measures and these resources in place, because as I heard from I think a nurse who thinks about precautionary principles, when we're not sure how great a danger is, an exposure is to someone, should we value their life above all other considerations and values, essentially, or our lives of distinct and potentially dispensable value? And I do feel and have seen how the devaluation of the lives of parents, not to mention the actual sickness and loss of parents, is devastating to children, especially children living in stressful situations already, as Gladys was describing in Chelsea. Hunger, housing insecurity, environmental exposures. The asthma rates in Chelsea are very high. All of that creates stress for a child. But pediatric science has shown that a lot of stress can be buffered by the consistent presence of a loving adult. And when that presence is lost, that is when stress becomes overwhelming, becomes toxic. And actually, that stress creates biological responses in the child's body that can be passed down to the next generation. So losing a parent, having a parent severely ill, and for some children, losing this parent or losing this loving aunt or grandfather who provided that buffer against toxic stress is a harmful, devastating impact on their lives that can harm the following generation. We know that, for example, from Holocaust survivor families, and it's been shown in genetic research that epigenetic changes take place. So for children to see that their parents' lives, their teachers' lives are considered less important than the resources that need to be put into schools and workplaces to make them safe, to protect their lives, that is very harmful to the child. It is frightening because the child must fear that they could lose their parent or their loving, protective adult at any moment.
So we're coming close to time, but I want to toss out a question to all of our panelists, and you can all sort of jump in. We've heard a lot of different pieces of the puzzle today. We've been thinking about aerosol transmission and airflow. We've been thinking about community transmission rates. We've been thinking about mask wearing and distancing in the classroom. I'm wondering if, and this is to all of you, if you had 3 things that you would name as like the top 3 things that schools need to do to consider reopening safely. I want to add asymptomatic testing into that mix. What would you put out as the things that you would want the school, especially to the parents on the panel, to where your child went, or Julia, where your patients went, to help keep the school safe?
Dean, you want to start with that?
Sure. I have 3 children in Amherst Regional High School, so I can speak to this. So, from my perspective as a parent, and I should say a person of color with extended family and friends that worry a lot about the impact of the virus, I think that what I want to know is what's going on in terms of the ventilation system, because we know that increasing the number of air exchanges significantly reduces, mitigates transmission of COVID-19. And so those numbers and that adequacy of the ventilation system is extremely important. This is something that we've been emphasizing on the Environmental Health and Safety Committee. But you've also heard me say I'm a member of the faculty at the University of Massachusetts, and we as workers benefit, and students benefit from widespread surveillance of COVID-19. It really makes a difference in terms of handling and anticipating potential outbreaks. So for me, if I had to pick 2, I would go with those. But to that, we'd also add masking and appropriate social distancing, which isn't always available in every school building in the same sort of way. But just one other point, even with respect to higher education and in public higher education, we have to think carefully about social distancing, ventilation, and surveillance with respect to the campuses in which we work and inhabit. So I would say ventilation, surveillance really need to be emphasized, and we really need to demand for children, parents, communities in the Commonwealth that this be a commitment of the state.
Thanks, Dean. Any one of you can go next. And we've got Kyle back too.
I can say that we think a lot about this in the context of workers in general. And I think that the 3 things that come to mind for me are, first, science, and it's science that leads us to the ventilation and the surveillance and the masking. And I have to say, we have not been completely convinced that science has been at the base of our policy decisions around this virus. And that really needs to change, based on the regulations, based on our approach to schools, all of that. Science will help us find the safe space within our schools, keep it safe, and use it to keep students and educators safe. The other is enforcement. And this is something that's really critical. If workers find themselves, and this includes educators, in an unsafe space where regulations are not being followed, they need someone to turn to. They need to know that that will be enforced and that there's someone who's going to step in. That is not clear for teachers who've been exempted from the state's regulations on who's going to do that. And that needs to change. And finally, a safety net. People cannot follow public health guidelines without a safety net. If a teacher, if an educator, if someone on school staff is exposed, they need to be able to take those weeks off, ensure that they're being paid, and ensure that they're able to put food on the table for their families. So those are really critical. And science is broad. It includes the surveillance testing, it includes the ventilation, but it's been lacking in protecting workers in Massachusetts.
Can I jump in with just one point about the social safety net? I really appreciated the first panel's discussion about testing, and also, Dean, your intervention. What worries me, though, is that unlike a campus where you say to the students, you quarantine for 2 weeks, the school still gives you food, you have housing, the burden falls on the parents. So you test then an entire class, and if you're a single parent or you can't take care of your kid for 2 weeks, like what happens? So testing has to go hand in hand with wraparound services, so that once you identify kids or a family that need to quarantine, you also provide them the means to do so. And that we have failed to take it one step further. And that's where the inequities are going to widen. If we have universal testing, we're going to see some parents being able to accommodate those, say, 10 days of quarantine, and others really losing their jobs or not being able to accommodate. So testing has to be accompanied by a robust social safety net.
Thank you, Natalia. That is really important and true. Kyle, I wonder if you have thoughts to share.
I don't know if I can say it any better than our panelists already have, but I think I have to be the staunchest advocate for testing. It has completely kind of redirected our cognition, to be really focused on helping students through the crisis and whatever kind of means that they particularly need. So, I do think that sometimes reopening schools is seen as the panacea towards getting back to normalcy, but things are not going to be normal for a very long time. So to really drop that kind of facade and embrace testing is going to be the best way, I think, to get us to a point where we can develop programs in school where we can be meaningful learners, and then we can also potentially invest in our students at home supports too, inclusive of their basic needs, but also of their educational needs too.
Thank you, Kyle. And Julia, any words to add to this discussion?
Well, the other panelists have already spoken so well and so strongly on the measures that are really needed: the ventilation, the protection in the community, the protection of all the parents in all workplaces, the social safety net. So I'm just going to say some more general things. I think the value of every human life. Let's prioritize the value of human life and let's put our resources there. Let's prioritize all human lives equally. Let's not accept illness and death as being caused in school. Schools should be places of joy and learning and growing up. They should not be places of fear and origins of sickness. And let's show our children that their lives, the lives of their parents, of their community, are the most worthwhile, the most valuable place to put our resources as a commonwealth. And that, we have to mobilize those resources that we have as the third most or fourth most wealthy state in the richest country in the world, to keep our children, our rising generation, and their families safe and learning and nourished in physical and in emotional and in intellectual ways, so they can really grow up to be who they want to be and who we want them to be.
Thank you all so much. This was such an important conversation that really just pulled out the themes of values, equity, resources. We all share the same priority that the best way to educate our students is in person. And it's honestly the thing that our educators are dying to do, is get back to their students face to face. We can do it if we have the resources, and the resources do exist in the wealthiest country in the world. We are holding a series every Thursday. Next Thursday, December 17th, we will be doing a series through January, because it just feels important to have a community conversation to get deeper than the op-eds in the Globe,
Right.
the 30-second sound bites on NPR. All of that's important, but we need more time. Carlene, I'll turn it over to you. It's been a pleasure to moderate with you, but I'll turn it over to you for your closing thoughts.
Thanks, Mary. And it really has been a pleasure to moderate with you as well. And to the panel that I see before me on the screen, it is really such a joy to learn from you, to hear your nuanced and thoughtful ideas that you can tell. I think everybody can feel that they are coming from a place of wanting what is best for our kids and our families and our communities. And that is a really wonderful thing to be a part of. So thank you very much for being here with us tonight. I think that you've given me and my organization some additional things to think about as we fight for the policies that are needed in this state to make reopening schools safe in all communities and not just some communities. So again, I couldn't be more grateful. Thanks for being part of this.
Great. Thank you, everybody. And we hope to see the live audience next week.
Take care, everyone. Have a good night.